Are any of you familiar with hemangioma? Some of you may know them better as a strawberry mark. I chose this topic because it's close to my heart. My niece was born on October 2010, and she was born with this condition of a strawberry mark on her face. This is my niece. You can see the small dark red mark on the side of her cheek. I researched this topic so I can be there to reassure my sister that while this disease or condition is heartbreaking and it's sad that her daughter has to deal with this, that this condition is not life-threatening for the most part. I'm going to talk about what hemangiomas are, the risk and complications involved, and how they diagnose and treat hemangiomas. A hemangioma is a benign vascular tumor that resembles a birthmark, most commonly found in infants. Hemangiomas are attributed to the accumulation of raised blood vessels in the layers of the skin. Some hemangiomas lay flat against the skin, while other hemangiomas are more raised and inflamed. According to the National Center for Biotechnology Information, the article they produced on October 2010, a third of these hemangiomas are present at birth, while the remaining hemangiomas show up in the first several months of an infant's life. Hemangiomas are distinguishable by type and color. Hemangiomas can develop near the surface of the skin, which is called a capillary hemangioma. They're also deeper within the skin near the muscle, and that's called a cavernous hemangioma, or it can be a mixture of the two, which is deep within the skin and on the surface of the skin. And here is a visual of the three different types. The first one being the surface, and the other one being deeper, and the last one being the combination. Hemangiomas can be bright red in color. They can also be a reddish blue in color. Just depending on how deep they are in the skin, they're going to appear darker. They are most commonly found on the neck and the face. However, they can be found on the scalp, the chest, or even the back. Next, we're going to look at the risk and complications associated with hemangiomas. According to the Boston Children's Hospital, hemangiomas are 3 to 5 times more common in females, especially fair-skinned girls, than in males, and they occur more often in Caucasian infants than in Asian infants. They are very rare in African American infants, and premature infants are more likely to experience or have hemangiomas. Most hemangiomas will grow and shrink without ever causing any issues. However, some complications can come with hemangiomas. The most common would be a wound or a scab, which may cause bleeding or scarring or infection where the skin is stretching around the hemangioma. I know this happens occasionally. With my niece, within 3 months of bringing her home, it had scabbed off and become very red, but it went away quickly. Other rare complications include problems with breathing and eating, vision problems, and possibly psychological problems due to the appearance of the skin itself. So now that you understand what hemangiomas are, we're going to look at how they're diagnosed and treated. Hemangiomas are diagnosed and treated based on appearance through a physical examination by the doctor. And although diagnostic testing is not typically done, an MRI or CAT scan will be done based on how deep it is, or for combination hemangiomas, just to make sure that what they know is going on. About 50% of hemangiomas will go away by the age of 5, and 90% will be gone by the age of 9. Most do not require any treatment because they go away on their own. However, if they are obstructing vital functions such as breathing, eating, or vision, a doctor will treat it. Treatment options include laser surgery and corticosteroids. Both treatment options include potentially serious risks such as pain, infection, high blood pressure, or high blood sugar, and even cataracts. Here's a visual of a baby who went through treatment before and after. Just 2 months apart, you can see the difference of the appearance of the child. So I have talked about what hemangiomas are, the risk and complications associated with them, and how to diagnose and treat hemangiomas. I realize there's only a small chance that any of you will be ever close to someone who has a hemangioma or maybe have a child with a hemangioma, but hopefully this helps minimize any fears or concerns you might have. This is my niece, just a final, just to give you some hope that they do start to disappear. This is her first birthday, and her cheek is obviously a lot better. You can see the edge of it, but the dark redness has gone away.